St. Joseph Health System is actually an integrated healthcare system of 14 hospitals, which we call ministries, that are in Northern California, Southern California, and in Texas. St. Joseph Health System began their partnership with Zynx Health back in 2002 when we embarked upon our first implementation of electronic health record. Since that time, we have 9 hospitals or ministries up on CPOE and fully engaged electronic health records, and we use Zynx Health for development of all of our evidence-based order sets with the clinical decision support in that. Prior to the use of our CPOE, or an electronic health record, all the order sets were on paper, and we had variation in practice throughout the health system. And so this project allowed us to decrease variation, provide clinical decision support at the point at which the physician was ordering medications, nursing care, and other interventions and diagnostic testing.
I think with the evidence-based order set that Zynx provide, and with these are evidence that this is the right thing to do for the patient. There's clinical evidence to back up the way we do things. At the same time, it's also standardized the way we care for the patients. So the outcome, the treatment outcome for the patient is greater than versus you don't have a lot of evidence backup.
Not only did we benefit from a single central build within Zynx of the content, we actually were able to import the order sets into Meditech and not have to build each of the order sets line by line, which we previously had to do. So in a complex order set for a critically ill patient admitted to the intensive care unit, those line items may be over 100 items within an order set. We're looking to improve the quality and reduce the costs within the health care that we deliver to the communities that we serve. And this value and imperative looks at many different processes that we, in delivering care within the health system. And there were a couple that were targeting clinical effectiveness. One was care for stroke patients as well as sepsis. And so we leveraged teams that we have had in existence and relied strongly upon Zynx Health, the order set, to help us build the order sets that were part of the toolkit in implementing this clinical effectiveness. And we were able to improve on mortality, our OE ratio for mortality, and we looked at length of stay and complications, and we were able to make substantial improvements in the care that we delivered.
Zynx provide us as a platform that the evidence is there. I don't have to do a lot more research behind the evidence, or why we use drug A or drug B to treat sepsis or stroke, because the evidence behind it.
So the relationship between Zynx Health and Meditech has really made our life very wonderful in being able to accomplish this task. And so again, it ensures standardization, but the availability to adapt at the local ministry. But it's a very simple process and allows us tremendous efficiencies.